What if the burning, shooting pain running down your leg right now isn't coming from a damaged nerve at all, but from something your body is doing around that nerve, something you can actually calm down in the next few minutes? Hey everyone, welcome back to Prime Health Lab. If you're new here, this is the place where we break down real simple science to help you feel stronger, steadier, and more like yourself again. No fluff, no jargon, just things that actually work. Today we're talking about sciatic nerve pain and a cold water technique that's been quietly used by physical therapists for years to take the edge off a flare-up fast. If topics like this matter to you, go ahead and hit subscribe, because we cover one of these every single week. All right, let's get into it. The first thing you need to understand is that this isn't about fighting your body, it's about working with it. When your sciatic nerve gets irritated, usually from a disc, a tight muscle, or swelling pressing against it somewhere along your lower spine, your body responds by sending extra blood flow and inflammatory fluid to that area. That's actually your body trying to help. The problem is, in a tight space like your lower back and hip, that extra fluid has nowhere to go. It builds up, it presses on the nerve even more, and that's when you get that burning electric shooting feeling down your leg. So here's where the cold water technique comes in. And I want to walk you through exactly how to do it, step by step, the way it's actually meant to be done. Step 1. You want a source of cold. This can be a bag of ice wrapped in a thin towel, a gel pack from your freezer, or even a bag of frozen vegetables in a pinch. The key word here is wrapped. You never want ice sitting directly on bare skin, especially for those of us over 50, because skin gets thinner and more sensitive to cold with age, and direct ice contact can actually cause a small burn without you realizing it until later. Step 2. Find your spot. For most people, the most effective place isn't actually where the pain is shooting, it's at the source, which is usually the lower back, right where the spine meets the hip, sometimes called the sacral area. If you're not sure exactly where, a good rule of thumb is to place it on whichever side of your lower back feels warm, tender, or slightly swollen to the touch. Step 3. Apply it for 12 to 15 minutes. Not 30, not an hour, 12 to 15. This is the part most people get wrong. They think more cold means more relief, but past that window you actually start to lose the benefit, and you risk reducing healthy circulation to the area for too long, which can slow healing rather than help it. Step 4. And this is the part almost nobody talks about. While the cold is on, gently rock your pelvis forward and back, or do slow, easy marching in place if you're seated. You don't want to stay perfectly still. Cold on its own reduces the swelling pressing on the nerve, but gentle movement helps that fluid actually drain away instead of just sitting there. Cold opens the door, movement helps walk the inflammation out. Step 5. Give your body a break of at least an hour before reapplying, and don't do this more than 3 to 4 times a day during a flare-up. Your tissue needs time to rewarm and recirculate in between. Now, a quick but important note. Cold therapy is excellent for calming an acute flare-up, that sudden, sharp increase in pain. It is a tool, not a cure. And that's actually good news, because it means you're not relying on one single trick to manage something this complex. If your pain is constant, getting worse over time, or comes with numbness, weakness in your leg, or any change in bladder or bowel control, that's your body asking for a real conversation with a doctor, not a home remedy, and that's worth listening to. But for the day-to-day flare-ups, the tightness, the moments where standing up from a chair feels like a small battle, this technique, done correctly and consistently, can genuinely take the edge off and give you back a sense of control over your own body. And that feeling of control, more than anything else, is what we're really after here. Now let's talk about something that takes this from a quick fix to something that actually builds lasting relief. Because cold water alone, even done perfectly, has its limits if you're doing nothing else around it. Here's the interesting part. Many people who find some relief with the cold technique make one mistake afterward. They go right back to whatever position caused the irritation in the first place. Usually that's sitting, often for long stretches, in a chair that puts extra pressure right on that nerve pathway. So step 1 in extending your relief is what I call the reset position. Right after your cold application, while that area is calm and the swelling has had a chance to settle, lie down on your back for 5 to 10 minutes with your knees bent and a pillow underneath them. This takes pressure off your lower spine and gives the nerve a little extra breathing room while it's in its calmest state. Think of it as giving your body a clean slate to work from, instead of immediately putting it back under the same load that caused the problem. Step 2, and this one surprises people, alternate temperatures can extend the benefit even further. After your cold session and your reset position, about 20 minutes later, apply gentle warmth, like a warm towel or a heating pad on a low setting for 10 minutes. Here's the simple logic behind why this works. Cold calms the swelling and slows down the irritation signal. Warmth afterward brings fresh, oxygen-rich blood flow back into the muscles surrounding the nerve, which helps them relax instead of staying tight and guarded. It's a 1-2 combination, cold to quiet things down, warmth to invite healing in. You don't need to do this every time, but on days when the pain has been particularly stubborn, this combination often outperforms either one used alone. Step 3 is about what you do with your day, not just your 10-minute treatment window. If you spend most of your day sitting, set a simple timer for every 30 minutes. When it goes off, stand up, even if it's just for 60 seconds, and do a gentle backward lean, hands on your hips, leaning back slightly like you're stretching after a long drive. This small, repeated movement throughout the day prevents the kind of prolonged pressure buildup that creates the need for that emergency cold treatment in the first place. Prevention, done in small doses throughout the day, is far more powerful than any single technique used after the pain has already flared. Step 4. Pay attention to your sleeping position, because for many people, nighttime is when the nerve gets the least relief and the most aggravation, simply because we don't notice we're lying wrong for 7 or 8 hours straight. If you sleep on your back, that same pillow under the knees trick from earlier works beautifully overnight. If you're a side sleeper, place a pillow between your knees so your hips stay level instead of twisting, which keeps pressure off that lower spine area where the nerve originates. This one adjustment, as simple as it sounds, has been the turning point for a lot of people who couldn't figure out why their pain was always worse first thing in the morning. Step 5. And this is the piece that ties everything together: consistency over intensity. The temptation with any pain relief technique is to do it intensely for a few days when things are bad, then forget about it the moment you feel better. But nerve irritation tends to come back if the surrounding muscles and tissue never get the chance to fully settle. Doing the cold technique, the reset position, and the daily movement breaks consistently for 2 to 3 weeks, even on days you feel fine, gives your body enough time to actually calm that whole irritated area down at a deeper level, rather than just managing the symptom every time it spikes. What all of this really comes down to is this: you're not just treating a flare-up when it happens. You're building a small, repeatable system around your day that keeps the pressure off that nerve in the first place. And that shift, from reacting to pain to gently preventing it, tends to be the real turning point. People remember months later when they realize they haven't had a bad flare-up in weeks. Here's something worth sitting with for a moment. A lot of people listening to this have been dealing with sciatic pain for months, sometimes years, and have quietly started to believe it's just something they have to live with now, that it's simply part of getting older. I want to gently challenge that idea, because the way your body responds to consistent, gentle care doesn't actually stop working as you age. It just needs a little more patience and a little more structure than it did when you were 30. So let's talk about how to bring everything together into something you can actually stick with, because the techniques only matter if they fit into a normal week. The first thing you need to understand is that you don't need a complicated routine. You need a small one you'll actually repeat. So here's a simple way to think about your week. Pick one consistent time of day, ideally when you're naturally going to be sitting or resting anyway, like right after lunch or before you wind down in the evening. That becomes your anchor point. At that anchor point, you do the cold application, the reset position with knees bent, and if it's been a tough day, the warm follow-up. That's it. One dedicated window, 5 days a week, rather than trying to scatter little efforts throughout the day and losing track of whether you're actually doing anything consistently. Around that anchor point, you layer in the small habits we talked about, standing every 30 minutes, adjusting your sleep position, and that gentle backward lean a few times a day. None of these require special equipment, a gym, or anyone's help. They fit into watching television, sitting at the kitchen table, or lying in your own bed. Now here's the part that really matters for the long run. People often measure progress by asking, is the pain completely gone yet? And when chronic pain has been around for a while, that question can actually work against you, because relief tends to show up gradually, not all at once. A more useful question is this: am I having fewer bad days than I was having a month ago? Is the pain less intense when it does show up? Can I sit through a meal, a car ride, or a movie without needing to shift every 2 minutes? Those smaller wins are the real signs that the underlying irritation is settling down, even before you feel like you've won. It's also worth saying clearly, this approach works best as part of a bigger picture. Staying generally active with gentle walking, maintaining a healthy weight if that's relevant for you, and keeping the muscles around your hips and core gently engaged all support the same goal, which is taking pressure off that nerve pathway long term. The cold water technique is a genuinely useful tool, but it works best as one piece of a body that's being cared for as a whole, not as a standalone fix you reach for only in emergencies. And if you've tried approaches like this before and felt discouraged because relief didn't last, I gently offer this. The difference is usually not in the technique itself. It's in the consistency and the small daily habits surrounding it. The body responds to patterns, not single events. A cold pack used once won't undo months of pressure on a nerve, but a cold pack used wisely, paired with movement and proper rest positioning, repeated consistently, absolutely can shift how that nerve behaves over time. You've made it through real, practical information today, and that alone puts you ahead of where you were 20 minutes ago. The goal here was never to hand you a miracle. It was to hand you something simple, repeatable, and genuinely backed by how your body actually works. Something you have full control over starting today. If there's one thing I want you to walk away with, it's this: you are not broken and you are not stuck. Your body is simply asking for a little patience and the right kind of attention, and now you have a real way to give it that. So here's my challenge for you this week. Pick your one anchor time, try this routine for 7 days straight, and notice, even just a little, whether your bad moments start showing up less often. If this video helped you understand your own body a little better, hit subscribe, because we're building a whole library of simple, real tools just like this one, made specifically for people who refuse to let getting older mean giving up their strength. I'll see you in the next one.
Prime Health Lab is dedicated to men's internal health. Don't forget to like, share, and subscribe.